Hello everyone. What are the key CMT milestones, markers, and interventional therapies to consider when raising a child with CMT? My name is Jerath. I'm the Advent Health Orlando Neuromuscular Medicine Director. I'm very excited to belong to this Hereditary Neuropathy Foundation Thrive Patient Center CMT Summit. So here's a welcome from the Advent Health Orlando Neuromuscular Center. So we started about 2.5 years ago from scratch, and boy, has it grown. We are a Hereditary Neuropathy Foundation Center of Excellence, which we're proud of. We also have an electrodiagnostic lab that has an exemplary status. We are a partner in care for the Myasthenia Gravis Foundation of America, as well as being an ALSA affiliated clinic, and we are an MDA care center. We also have 2 clinical trials, one for CMT1A as well as one for ALS. Our Neuroscience Institute is grown, and I'm very proud to belong to such an amazing group of physicians. So let's get started and talk about CMT milestones, markers, and interventional therapies in children. First, before we get started, the diagnosis for CMT involves quite a few things. Sometimes we go over a clinical exam, family history, electrodiagnostic and genetic testing, and when parents find out that their child has CMT, there might be a wide range of emotions. These emotions could include feelings of sadness or fear, guilt, anger, frustration, and before any of these diagnoses are made, and even when they are, I recommend that parents watch and take care of their emotions, actually observe these thoughts, so that if there are negative thoughts and emotions, these negative thoughts turn into positive ones. It's important to create a positive environment for kids to make sure that they're very happy and healthy. A very important theme throughout this talk is that CMT presentations can vary. There's a large variety of presentations for CMT, whether it's in the same gene. The same genetic mutation can produce a different variety of presentations, or even in the same family. So a family member can have a very severe form of CMT, and another family member can have a very mild form of CMT. And so there's a lot of variability. When we say mild, some of them can be little to no symptoms, or very severe. Some patients can be in a wheelchair or need a respirator. Children with CMT should be treated just like other individuals, and other children, they should explore their desires, their goals and activities. So if they're not able to do certain activities, this is the time to be creative and to explore. And we should have an attitude of fun and trying things and excitement rather than negativity and giving up. So favorite activities that a lot of my patients have include swimming, horseback riding, singing, reading, or yoga, and it's time to be creative. There was a paper that was done, a study in 21 children who had CMT1A, and it was important in this study that showed that many of the kids had a lot of variety in their presentation. In fact, some of them had a very mild presentation. Motor development was normal in all the children except one child. The age of onset was variable. Some children presented at 12 months and some at 11 years. And one child was completely asymptomatic. Another type of presentation, some kids had different types, and they presented with fatigue, falls, clumsiness in walking, running, or difficulty with climbing stairs. It's interesting to know that some children had foot deformities, but that was only 29%. And only 10% had difficulties or abnormalities with a gait, so that they presented with toe walking. So there's a lot of variability, and some of these patients can be very mild, and it's very reassuring. What was really important was that children themselves had a very mild perception of their disability. And that's very interesting. I see this in the clinic all the time, is that when I ask children who are typically playing on their iPhone or iPad, they're really not interested in the clinic visit. I say, are you doing okay? Yeah, they're doing fine. And then I suddenly ask them, how many times do you fall in a day? And then they look up and they say, oh, 15, 20, and they don't really make much of it. So they don't really notice that they have much disability. And that's a good thing for parents, but also we should recognize that we have to ask the children how they're doing. We have to be careful and make sure that they are okay. So a CMT PED score is an outcome measure for CMT, and some of the really nice components is that we use things like hand dexterity. We do a 9-hole peg test, and so we check how fast the patients can actually take 9 holes and put 9 pegs and put them in holes, and see how fast they do that. We check the strength, we check the hand grip strength, the foot plantar flexion, foot dorsiflexion strength. We also check sensations such as pinprick and vibration, and also different activities of balance, such as standing with the feet apart on a line, eyes open and eyes closed, or standing even on one leg on a line or beam with the eyes open and eyes closed. We check the gait, and we do a 6-minute walk test as well as a long jump test. Those are excellent measures of outcome in the clinic. CMT therapeutics in general, as soon as I see a patient with CMT, I usually say, okay, let's go ahead and you should do physical therapy and occupational therapy, as well as make sure that you have proper shoes and orthotics. And the reason why physical therapy is very important is because stretching and strengthening, those exercises can help with balance and with walking and day-to-day activities. Occupational therapy is excellent as well. It helps with hand strengthening and fine motor skills. Shoes and orthotics can make all the difference in terms of safety and pain management. Sometimes patients need orthopedic surgery, so that helps correct foot deformities. We also discuss just basics like nutrition, weight management, sleep habits that are good, as well as regular physical activity, which are important not just only in kids but also in adults. So now let's move on to more specific therapies for kids who have lower extremity weakness. Now there's an excellent paper here that involves the clinical practice guidelines for CMT. This was written just about 2 weeks ago, early 2022. And this talks about the use of progressive resistance exercise of the ankle dorsiflexion. So dorsiflexion, say this is my foot, dorsiflexion involves pulling the foot up. And so if we do progressive resistance exercise of the ankle dorsiflexors, this can improve muscle strength and slow the progression of muscle weakness. The paper discusses this as a very nice treatment for CMT. They also discuss that things like vitamin C, we did a trial for vitamin C and CMT1A, and it really was not very effective, as well as Botox. So Botox for lower extremity flexible cavus foot deformity, just not recommended at this time. And in order to emphasize the fact that dorsiflexion resistance training is safe and effective, is to go over a trial called the FAST trial. So in this trial, children wore a boot over 6 months, and they did the dorsiflexion resistance training, and it was found that this was a safe and effective exercise, and it could slow down this long-term dorsiflexion weakness over these 6 months and over the future as long as it's done. I had a patient a few days ago ask me, Dr. Jerath, what do you do when your child has muscle wasting, muscle atrophy? And I told them, if it's in the leg and it's one of those leg muscles that actually pull the foot up, the dorsiflexion resistance training can help slow the progression down. Patients can also have weakness in their hands. Sometimes that's overlooked. A lot of kids say they don't really have anything wrong, but they do have weakness. And it's important for these kids to do things like Therapeutics. Sometimes they can hold 2 marbles and move their hands to actually work the muscles of the hands. I tell all my patients to do stretching of the hands. This is one example. And there was the paper that this is shown to be very, very well tolerated in patients. All right, so one of the topics that I've talked about is that children really don't endorse the fact that they have issues. And so if they do have hand weakness, it's important to make sure that they have adaptive equipment, and that can improve their activities of daily living. Another thing that we can use are adaptive keyboard settings, as well as voice recognition software. I had a child the other day in my clinic. We have a lot of kids in our clinic. And he was playing on his iPhone, and I asked him, I said, hey, how are you doing? And he said he was doing fine. I said, how was school? School was fine. And I asked him, about if he was having problems with weakness. He said, no. And I said, are you running with your friends? And he said, yeah, he was running. So everything seemed fine. He was back on his iPhone, not really paying attention to me, not wanting to be there in the clinic, obviously. But when I asked him again, I said, of course, I asked him about what books he was reading, what he was studying. He was doing great. But then I specifically said, hey, do you need more time to take your tests in school? And he looked at me and he said, oh yeah, I need more time. I wish I could have another half an hour to an hour to take those tests, because his handwriting was slow. So it's really important when we talk to kids to ask the kids if they need more time, or be very specific, because they really don't perceive any disability. But when you ask them, look, are you having difficulty with your tests? Do you need more time? They will say they do. So that's important for kids, and it's important when you see your doctor, your specialist, to have a letter written so that these kids can have more time in school if they need it to take tests. And then sometimes children will have such severe hand weakness that they need functional splints that will improve their function in targeted activities, but that's a case-by-case basis. We don't typically see that on average. So in general, say you want to get your child to have stronger, to have physical therapy. What do you do with strength training? And the recommendations for strength training involve a tailored strength program that should be, it's a strength training program that should be supervised by a physician or a physical therapist. And what we recommend is really low resistance and then gradual build up. You don't want to go from 0 to 100, just a very gradual build up. It's important when we do this training and resistance training and strength training, we want to focus on the core muscles and encourage rest days to actually help with recovery. Now, there are sometimes, very rarely, red flags when we do strength training, and that can include muscle damage, which sometimes kids will say, they have cramps and muscle pain, or they may have dark brown urine. And if they do have those signs, or they complain of that, it's important to modify the exercise or actually stop it. So if the child has problems with maintaining and improving joint range of motion, there are things that I tell my patients all the time. And I always say stretching, 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 stretching. I tell them all the time, stretching is so important. Stretching in the morning, stretching in the evening, just make that a part of their life. Now, if they have problems, we can always, so say their foot doesn't go up, like that's what we call dorsiflexion, and they have a difficulty with the range of motion. We do recommend serial casting to improve that ankle dorsiflexion. And sometimes if the serial casting cannot be done, we can just do that in the night. CMT and orthotics, this is a really important topic, because shoe inserts and orthotics are really important because they can help decrease foot pain in children. And of course, bracing is great in general because it helps with the dropped foot, with falls, and with stability. But what happens in kids is that they get the braces and they work well. But when the kids grow older, the braces do not get updated. So I see this all the time in the clinic, is the kid is having foot pain, they're having difficulty with falls, they're having difficulty with balance, and yet they're not wearing their brace because the brace is hurting them. The brace is old, the brace is small, and it's not been updated. They've lost in touch with their doctor, they've never been followed up. So it's important that the braces are maintained in children because in general it reduces that joint pain, improve the range of motion, as well as improving energy. There might be issues, and I've seen this quite often, in kids with bracing and social concerns. And every kid is different, so we have to tailor the braces to each individual child. But sometimes we can offer them silicone braces. These are softer, lighter weight braces that are not as hot or not as heavy. There are also braces that are called SMOs, or supramalleolar orthoses. These are also lighter and smaller. So again, each individual is different, and not everyone needs a brace. Sometimes the braces can be worn on an as-needed basis. CMT and pain. In children, pain is not very often seen, but again, each individual is different, and so children can have pain. And for those that have pain, the first thing that's important is to figure out why. Is it in the muscle? Is it in the bone? Is it in the nerves? And so if it's a musculoskeletal pain, it's usually a muscle ache, muscle fatigue, or sometimes there's a cramp. If it's a problem in the bone, usually it's a problem where they're feeling a specific joint pain, or they have pain in a specific area, and they usually point to the bone area itself. And then if it's in the nerve, typically it's a problem with stabbing, burning, sharp pain, or even tingling or numbness that can affect the children. And for that type of pain, which we call neuropathic pain, we usually give like a lidocaine cream, Voltaren gel, even a vitamin supplement called alpha-lipoic acid, gabapentin, pregabalin, or Lyrica. And then, in children, it's really important not to give them narcotics or opioids as much as we can. We want to avoid that as much as possible. Sometimes the kids complain of cold feet. And if their feet are cold, I usually recommend heated socks. And as we always recommend, if they have pain in their muscles, again, say stretching, 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 stretching. For balance impairment, some of the kids have trouble with balance, so they can't walk on a balance beam, they can't walk across a log over a stream. And for those kids that have that problem with balance, we always recommend, look, they need to be aware of it and to retrain their balance. Some of the things that they can do are to improve the core and postural strength, as well as dance, Pilates, or not even non-contact martial arts. And sometimes we recommend play-based therapy. Cramps are very common in children with CMT. And again, it's my theme for this talk is stretching. So stretching is really important, especially of the muscle groups that are involved in the cramps. We also recommend sometimes exercise, massage, and magnesium for cramps. They may or may not benefit, but it's good to at least try them. If the child has CMT and has joint or spine deformities, there is a time when they need to go to the orthopedic surgeon. And in those cases, the kids will really present with a painful, disabling, or progressive pes cavus deformity that's just not responsive to AFOs or orthotics. I had a child in the clinic, he was very, very healthy, really minimally affected by CMT 1A, but when he walked, he was actually having a lot of pain in his foot. His foot turned inward, and he was not able to run like the other kids. He was not able to keep up with them. And we tried braces, but he still had the pain. So his mom and I discussed that surgery would be the best option. So he got the surgery, and I haven't heard from them since. They're doing exceptionally well. So sometimes the surgeries are very helpful. If they have an ankle contracture, say their foot cannot pull up, their ankle is very tight and stretched, we've done the casting, then maybe surgery might be an option. Sometimes kids may have hip dysplasia. It's important to recognize that, and they may need a hip x-ray to screen for that. And if they have moderate scoliosis, then it's important to see an orthopedic surgeon. So one of the most important messages in our clinic includes attitude. And a very famous success coach, Earl Nightingale, discusses a great attitude is not the result of success. Success is the result of a great attitude. And that's what I tell all my patients. And I personally have one of my favorite success coaches, Dean Graziosi, who in his exceptional talks and lectures discusses how we should focus on the positive. And I feel that children should do the same. So if you read his quote, your success depends on making it a habit to focus on improving what you're already good at to the point of greatness. And this is a very, very important part of our clinic. We can focus a lot on what we're not good at, but that doesn't really help sometimes. And for kids, and for adults, we need to focus on what we're good at and focus on our strengths. So here's a real life example of what Dean Graziosi talks about is Professor James Lupsky. He was a brilliant scientist with CMT who changed the entire landscape of CMT. He's currently the Cullen Professor and Vice Chair of Molecular and Human Genetics at Baylor College of Medicine in Houston. But he's just an amazing role model. He grew up in Hicksville, New York, and he and 4 out of 8 siblings, they all had CMT. But unfortunately, when he was 15 years old, can you imagine, he had surgeries on his feet that didn't allow him to go to high school. And he missed his sophomore and junior years of high school. And if we could take pause right here and think about our attitude and think about focusing on the positive, so many kids would focus on the negative. They would focus on the fact that they had to have surgeries. They would focus on the fact that they have pain. They would focus on the fact that they can't be with their friends and they can't go to school and all the negatives. But Professor Lepsky did the exact opposite. He focused on what he could do, and he focused on the positive. He studied at home. He read books that fostered his interest in science, genetics, and medicine, and also he became great friends with his surgeon, who became his mentor. So he ended up going to medical school, and he went to New York University, earned a doctorate in biochemistry and molecular biology, and also received clinical training in Houston and board certifications in both pediatrics and medical genetics. But he didn't stop right there. He continued to go. He received a Muscular Dystrophy Association grant, and I am so amazed and so impressed that in 1991, he found and identified the gene that causes the most common type of CMT. He found PMP22 gene, which is responsible for 70% of CMT cases. So up until 1991, we didn't know what caused CMT, and he found it. So he had so much success because he decided to focus on the positive and not the negative. And with continued MDA support, his team identified a handful of other genes associated with CMT, including the periaxin gene and the EGR2 gene. And he never stopped there. He himself had a rare gene, and he continued to search for it. So he never gave up, and he sequenced his own genome and compared his genome to a reference human genome and found out that he had an SH3 TC2 mutation. So what our message is in the clinic is, yeah, we have to work on our strength training and our stretching and our balance as well as the braces, and there's so many things to address, including pain and needing more time for tests. But I really want to emphasize today that in our clinic we tell our patients, our families, our children, the parents to focus on the positive, never to have the kids give up. And you never know, if we continue to encourage our children and they focus on the positive, they may themselves further the field of CMT. So our current state of CMT is that we are working on therapeutics. There are treatment approaches, including gene silencing and gene replacement therapies, as well as small molecule treatments, but these are only in the preclinical setting. So we yet have not put them in our clinics, but we do have 2 clinical trials with gene therapy. One is a viral vector. It delivers a neurotrophic growth factor, NT3, and then we also have a clinical trial for PXT3003. This is a cocktail of baclofen, naltrexone, and sorbitol. It downregulates the PMP22 overexpression, and of course, that clinical trial is being offered in our clinic currently. Our final points are that kids' stories should be focused on individuality, positivity, growth, fun, exercise, and doing what they're good at. So the next part of this will be a fun surprise. We know that in the 2022 guidelines for pediatric CMT, their recommendations are for dance, and that helps improve balance. So we'll be dancing and doing exercise dance to help offer a therapeutic option for our kids and parents together. There should be no stress and just fun.